Hi everyone, my name is Linnea. Um, I'm trying out this YouTube channel thing. I thought I would get on here and share a little bit about myself again. Um, so I am actually going through a divorce after 30 years of marriage. That's been something that I've been struggling with. I got a piece of hair in my eye. But I am finding that I'm not alone, and there is a lot of other people going through great divorces, as they call it. This year we had been married 30 years, so it's been a big transition. Um, but we have two adult sons, and they have been amazing support for me. And I guess I wanted to go on here to just share some of my life, to let some of you not feel so alone if you're going through something similar. I'm also a breast cancer survivor. I'm going through endocrine therapy still. I'm cancer free, which is very good. But I was diagnosed with two types of breast cancer, and one of them is an insidious type of breast cancer that can come back in around the 5 to 7 mark. And so I have to stay on the medication I'm on, anastrozole, which is supposed to help prevent it from coming back. But at the same time, it has side effects. One of the main side effects for me has been chronic fatigue and joint pain, especially in my hands and wrists and my knees, and vertigo. So I am navigating all of that. I've been on it for a little over a year, and it is getting better. And there are other medications that I can go on, but the side effects are very similar. So I've already invested time and getting used to these side effects. So I'm going to try to stay on this medication for the next 10 years. I'm told that I need to be on it, which is fine. I went through a mastectomy last year, went through a lot of recovery. I went through reconstruction surgeries, which was a good choice for me. I'm 57, so a lot of things have hit me in my 50s. But I am finding out that there is life on the other side. I'm stronger than what I think, and I can do hard things. I'm also a counselor, and I love sharing mental health tips. I share things. Well, I went into the mental health field just because I know what it's like to struggle. I went through my own decades of trauma therapy. And when I came out on the other side, I had learned so much that I wanted to share it with other people, because and I realize everyone heals differently. What works for one person may not work for another. But I am here to tell you that if you do struggle with depression, anxiety, PTSD, complex PTSD, postpartum depression, I've been there. I've gone through it all. So I get it. And I'm also a 988 counselor. And I just want to let you know that if you need to talk to a counselor, even if you're not suicidal, you can call 988. It's for anyone who is in crisis, and a crisis can just be feeling overwhelmed. You don't have to be suicidal to be calling 988. So I want to encourage you. You can call, you can text or chat 988, and we're available 24/7. And I also do some online support groups, and one of them is called Begin Within on Facebook, and it's free if you would like to join that, where I also share mental health tips. But I guess lately what I'm really going through is financial stressors due to going through this divorce, which is contested by my husband. I'm also going through some other things that have to do with the caregiving of my mom, which has been really hard because she's my best friend, and it's so hard to see our parents or our loved ones struggling when we love them and just want to take away that pain for them. But anyways, I'll be sharing just parts of my story and mental health tips along the way. One of my tips I share a lot with people on the phone is, and I do this personally, when I feel overwhelmed, and I know you probably have heard this a lot, is to take in a deep breath, like pretend like you're smelling the roses or flowers through your nose, and then blowing out candles through your mouth. So remember to smell the roses, blow out the candles today, and if you need to, make a list, and on one side of the list, either on paper or in your phone or even in your head, but it's better if you can write it out. On one side, write things that are within my control, and on the other side, write things that are outside of my control. And then focus on the things that are within your control. Maybe it's calling 988. Maybe it's watching YouTube videos that make you feel better. Maybe it's taking a nap, spending time with your pet, going to a counseling session, learning some anxiety skills, and the things that are outside of our control, the way people treat us, the way people act or say things. Maybe it's circumstances, maybe it's politics and what's going on in the world. If it is bringing you so much stress to where it's hard for you to function throughout the day, try to focus, bring your thoughts gently back to the other side of that list, and ask yourself, what do I need right in this minute? So that's what I do personally, and some days it's moment by moment, just asking yourself, okay, how can I get through the next 15 days? And then, or not 15 days, 15 minutes. Or how can I get through the next hour? So those are a couple of tips that they sound simple, but they really do help. And the fastest way to regulate your nervous system, lower your stress, is through doing breathing exercises, because that tells your body you're safe. And, even just getting a drink of water and drinking it slowly, that can tell your brain that you're safe because you have time to stop and get something to drink. And your body will say, oh, okay, I can tell the nervous system now that it's safe, and it can relax. Because if anxiety and stress is something that you normally deal with, you may be hypervigilant a lot and on high alert all the time. And so your body and your emotions and your thoughts, that can be exhausting. So just know that you're worth taking care of, and do some self-care today. And feel free to leave me a comment if you can relate. And I am sending out lots of hope and love to all of you today. Okay, bye-bye.